people are having their vaccination appointments cancelled because their GP is saying you live outside the 10-kilometre radius, therefore you can't come to our practice to get your jab. Is that...
I'll ask Minister Hazzard to answer that question.
Yeah, it's pretty obviously vital that we get these jabs in.
Obviously you can go straight for your medical appointments. That's an misunderstanding, I think, by the GPs. So certainly the message is very clearly to GPs. There's always been an exemption to leave your home and to go for medical attention. And can I say there's just nothing more important than getting vaccinated at the moment. It's a challenge. We don't have enough Pfizer, but we've got plenty of AstraZeneca. And as the Premier has said, we're awash with AstraZeneca. But because of messaging that's come out, obviously, from both the advisory body and then translated by the federal government over the last few months, it's made people very hesitant to go and take the AstraZeneca. Sorry. So the short answer here is you need to get vaccinated. As the Premier said, if you're over 40, we can do that now, Hubs. If you're under 40, you can go and talk to your GP, and I'd encourage everybody, including the media. I was ecstatic to hear that Kyle and Jackie O have been doing their bit. Well, Kyle's done his bit with Get Vaxxed Baby. I love that song. That's fantastic. Anything we can do with the media to get out there and actually support getting vaccinated. There is no other solution other than listen to the requirements that health have asked you to do. The Premier's repeated it time and time again. We've obviously got issues about families still visiting each other and, unfortunately, the virus being spread when people go to their essential shopping. But there is only one real solution. At the end of the day, it's get vaccinated, or as Kyle says, get vaccinated, baby. Sorry. Yes.
Tighten anything that might need tightening to ensure that we have the right settings. Police have expressed some frustration that on the mask rules, requirements to wear a mask do not apply to anyone with a physical or mental health illness or condition, or otherwise, or a disability, that makes wearing a fitted face covering unsuitable. Now, there's no provision in the order for police to ask for proof of that condition. Should you change that?
Well, actually, again, the media have been generally, most of the media, have been very, very helpful. And I want to acknowledge Ray Hadley. Ray Hadley actually texted me at some stage late yesterday when I was dealing with a whole host of other issues that the media were raising, coming out of somebody backgrounding about something or other. And I was unable to address that until early this morning, but I've actually worked with health and instructed our lawyers to prepare an amendment to the orders, which I was hoping to have signed by 11 o'clock, but didn't get done because there was so much happening this morning. And that is to say that from here on in, if you're outdoor or if you're required to wear a mask, if you don't wear a mask for what you say is a medical reason, you will be required to have on your body, in your possession, a letter or other evidence from a registered medical practitioner explaining that that is actually a true situation.
And why did it take the media... Sorry, Minister, just to clarify...
Sorry, Danica, can I just finish with...
Yeah, why did it take the media raising this issue for you to fix it?
Because there are a whole host of issues that are being progressively... It's like you expect constantly everything to be perfect. I've said this 100 times. We are in a pandemic, a very serious pandemic. The playbook that... There was no playbook last year when we were dealing with Alpha and the earlier parts of this virus. And everything had to be done and learnt on the hop, as is evidenced by what happened last year. We're now dealing with effectively a completely new aspect of that virus that operates in its own horrendous way. And so we're still learning and we are doing what we can, but it's also proportionate responses. Sorry, Ashley. It's always got to be a proportionate response. As the Premier has said, we don't want to impose, as a government, we don't want, and no government wants to, well, perhaps some in other parts of the world, but nobody here in Australia wants to impose restrictions on our population that are absolutely unnecessary or that appear to be unnecessary. So we've got to do it proportionately and sensibly. We take health advice. We're always taking discussions. We have every day we have discussions with the police, and we try and strike that balance.